When I see people have a stroke, most of them don't recover to their full ability, right? Not only is this sudden and dramatic, but also it's long lasting and sometimes and often permanent. The fact that you're here educating young middle-aged professionals like ourselves about stroke and it could happen to them, that in itself is a reason to applaud you. You know, the first myth about age is clearly that's not true. But the second myth about preventing stroke is even more wrong, and it's even more hurtful to think that you cannot prevent a stroke, because if anything, we're much better able to prevent stroke than to treat it. So once a stroke happens, but like the way that it happened to you, once a blood clot or something blocks off the artery, we can sometimes go in with a clot busting medication. So I'll show up in the emergency room. Hopefully the person comes in time within 4.5 hours, but the quicker the better. We can give a medication that opens up the blood vessel that supplies blood to this part of the brain. And hopefully things sort of return to normal, which is what happened to you, right? There's another procedure that we can go in with a catheter and physically open up the blood vessel to restore blood flow. But really, at that point, for the most part, the part of the brain has already experienced some level of damage, right? By the time we're going in there with catheters and we are opening up blood vessels, again, it's one step too late. And ideally, we would have prevented this from happening. And so what can we do to prevent the stroke? So I already told everyone that stroke is caused by some sort of cutoff of blood flow to the brain. And so the biggest risk factors for cutting off blood flow to the brain are high blood pressure. High blood pressure is a silent killer for a reason, right? People feel great. I'm in my 30s, I'm in my 40s. I feel great. What are you talking about a stroke? I'm young. And hey, maybe I have a little bit of high blood pressure. I haven't checked it in many years, but I feel great. By far, that is the biggest myth to stroke that there is. And high blood pressure accounts for about 80% of strokes. If people were much more likely to take their blood pressure, act on it when it's high, and control it, we could prevent, again, up to 80% of strokes. And so by far, the biggest risk factor for stroke is high blood pressure. And the biggest myth is that I feel fine, therefore I'm not at risk. That's not true. People feel totally fine with an astronomically high blood pressure. And the only time that they don't feel fine is when they have a stroke.